Alright, cervical disc herniations are caused by when the annular fibers tear and there's migration of the nucleus pulposus. The age range is typically under 45-ish because the disc isn't degenerated. Whenever you get older, over 45 to 50, the disc is less hydrated and there is loss of disc space due to disc degeneration. The signs and symptoms is there will be radiating pain. Bilaterally will be a central disc herniation, and if there is an antalgic lean on the same side, then there will be a medial disc herniation. If there's an antalgic lean on the opposite side of pain, then there will be a lateral disc herniation. Relevant anatomy would be the ALL ligament on the anterior sides of the vertebral bodies and the PLL on the posterior side of the vertebral bodies, as well as the disc and nerve roots and the IVF, as well as the spinal cord and facet joints. The types of herniation would be broad-based versus focal. Broad-based would be over 25% of the disc herniated, and focal would be less than 25%. There's also contained and uncontained. Contained is if it doesn't protrude through the annular fibers, typically if they're not torn all the way. Then there's protruding and extruding. And protruding is if the base of the herniation is wider than the distance that it extends out. And extrusion is if it extrudes further than the width of the base of the herniation. Things that can go wrong is the annular fibers are torn due to trauma, such as a motor vehicle accident. There can be microtrauma from repetitive movements, such as flexion, that compresses the disc, or extension that separates the discs. And there could also be an insidious onset of herniation from poor posture. The herniation, depending on where it is in the neck, the most common is C5, 6, and 6, 7. And the C5 nerve root would cause numbness and tingling and muscle weakness in the deltoid region. The C6 nerve root would be the brachioradialis and wrist extensors. And C7 would be the triceps, and C8 would be hand grip and finger abduction. The type of imaging you could do would be an X-ray to show the disc height and the IVF height. And you could do MRI to show what kind of herniation and the extent of the herniation. And you could do CT in the case of extreme cases for bony malformations. Tests that you would perform is Jackson's compression. And you would first have them in a neutral position and compress down. Then you would laterally flex them both ways and compress. And you are getting IVF compression on the same side as lateral flexion. That would compress the nerve root. And on the other side, you're getting opening the IVFs and stretching the muscles. A few other tests you could do would be cervical distraction, which would relieve the pain and take the pressure off the nerve roots. You could do Bacodes, which would relieve nerve root tension, or Lhermitte's for space-occupying lesions. You could do some rehab, and those could be things such as postural exercises, muscle strengthening, advice on ADLs and aggravating factors, and inform them on nutrition and stretches to perform.